that right? We haven't put it there right. So we're going to add it. Higher than this. Okay? This is chain. Beta hemolytic. This is also using A disc. Basic treatment, sorry, here is wrong. This is resistant. This is A disc. It's susceptible. Rebecca Lansfield group A. Okay? So you're feeling these already. This is beta hemolytic strep. COCCU. You revise, you study the errors. Alpha hemolytic, gram-positive coxa, catalase test negative, sensitive to biosalts and other surface active substance such as optica. Okay, already tell you alpha hemolytic and the catalase test negative. It's Streptococcus. It is sensitive to optica. What is that? Is that right? That could be Streptococcus pneumonia, so that's Streptococcus pneumonia. Let's look at question number 6. A gram-positive coxa. That is catalase tested positive. Once you see catalase positive and the gram-positive coxa, it is Streptococcus. It is not Staphylococcus. It is Staphylococcus. It's not Streptococcus. Coagulase test negative and the resistant to low concentration of normal bouncing. Which one? Right here. That's why I said this table is important. Look at this table. Resistant low concentration of novel bouncing. That's why the doctor can be showing and knowing you have a honeymoon bacteria so quick, because around those three, only Staphylococcus apophyticus is resistant to novel bouncing, and the coagulase test negative. The others kind of similar. Okay, and alpha hemolytic. So this is Staphylococcus agalactiae. Can grow under fermentation lactose on McConkey agar, more than one answer. Then you tell me which one is on McConkey agar. So far, we learned E. coli, is that right? We learned what? Klebsiella pneumonia. Is lactose fermentation positive on the McConkey agar? What else? Can we look at the top? How about Pseudomonas? No. So the answer here is E. coli and the Klebsiella pneumonia. The two of them. This microorganism, question number 8. This microorganism can grow on selective media containing 7.5% salt, does not coagulate the rabid plasma, and is susceptible to novel bouncing. Again, does not coagulate the rabid plasma, susceptible to novel bouncing, but can grow on selective media containing 7.5% salt. Is that this one? Staphylococcus epidermis? Do we have Staphylococcus epidermis? Okay. Then what this question tells you? Can survive with 7.5% salt, which is a halophilus, which means can stay on the surface. Is that right? On the skin surface. So Staphylococcus epidermis, and that epidermis genome name already tell you this patient can grow on the surface. Question number 9. Belonging to a group of alpha hemolytic microorganisms that normally in the upper respiratory tract and may cause optimistic infection. This is alpha hemolytic. And normally live in the upper respiratory tract and may cause optimistic infection. Which one? We still left one here. Veridine, Streptococcus. Is that right? Okay, it's gram-positive. It is alpha hemolytic. How about optic and P disc? P disc is resistant. How about Rebecca Lansfield group? I will say they are couple, which means multiple. Okay, could be belonging to different. Therefore, this table we finished. Above Staphylococcus, below Staphylococcus. If you want to separate them, this is positive. Below is negative. Okay, how do you know? This is bubbling. We just talk about in the lab real quick. This is no bubble. Okay. So that table is important. You feel it. Okay, let's go to see some more questions. Is a gram-positive endospore log found in the soil? Then you tell me which one is in the soil. Is endospore forming from here? There is only two bacteria we have here. Is Bacillus and the Clostridium. If there's no Clostridium there, then it's going to be Bacillus. So Bacillus subacus. We did this in the lab. Okay, so it's G. That's question 10. Question 11. These gram-negative logs grow rapidly on blood and chocolate agar, producing mucoid colony and fermented lactose on the country agar. Look at the keywords here is mucoid colony. Which bacteria has mucoid colony? And the cheese-like colony on the agar plates. Which one? If you forget, let's say you forget. Okay, that happens all the time. Okay, so what you're going to do? Go back to look at your slides. So we go back and look at the slides. We open it. And we talk about here, we say, there is one slide showing you very clearly, there is a mucoid colony. Look at that. Like a cheese. So heavy. So what's that? Klebsiella ammonia. It's a mucoid colony. Okay, that's where we finish. Fastidious gram, question number 12. Fastidious gram-negative log will only grow on, this is modified chocolate agar, you don't have to worry, BG agar. But takes 5 to 7 days for colonies to form. Okay, that means above which one is fastidious gram-negative log? Which one? So the question here is, ask yourself, what are the two bacteria of fastidious in this section? Is Haemophilus influenza and Neisseria gonorrhea or Neisseria meningitis? Okay, so where's the answer here? Is here Haemophilus influenza? It is a gram-negative coccobacillus. What means coccobacillus? Like a coccell, like a logs, and the fastidious bacteria only on chocolate agar. So the answer is L. Okay, question number 13 is easy. Which pathogen causes whooping cough? Bacteria pertussis. Question number 14 is also very easy. Gram-positive log forming palisade arrangement. Palisade arrangement, do you still remember? What is palisade arrangement? This is another description we call clap shape. Therefore, it's Corynebacteria diphtheria. Okay, question number 14. Gram-negative log grow on chocolate agar, not on blood agar, which means it's a fastidious bacteria. And causing meningitis. And especially for the age group 2 to 5, which one? Okay, here we go back to this old story. Can you feel that in your mind? Can you feel it? Here tells using the age 2 months to 5 years old. It's a fastidious bacteria. So what is that? Is that right? HIV, type of B hemophilus influenza. Okay, then you go ahead to study. What's the first one? GBS, is that right? Staphylococcus aureus. How about this one? Neisseria. How about that one? Staphylococcus pneumoniae. See, you studied all these meningitis age group. Okay? Use this question. Because it's mentioned here 2 months to 5 years old. So how about the people older? How about the people 5 to 40 years old? How about the people in newborn? You should study all of them. Okay. Question number 16. Responsible for the toxigenic disease that produces a thick grayish pseudomembrane in the back of this route and has a bone neck. We already mentioned many times, Corynebacterium diphtheria. HIV vaccine for this pathogen. Go back and see the slides again. I already write HIV, hemophilus influenza. So see, these questions, you could do a concluded by yourself. Some of these questions are similar. You can combine them together and just write on your flashcard. These are the key words and the characteristics you can study and make it easy. Otherwise, you're only going to remember them. Okay, so that's something you can connect it. Question number 18. The Dtap vaccine contains a toxoid. We'll mention toxoid, chemical, toxic-like chemical, to prevent which pathogen from causing disease. What is Dtap? And I said it's going to be more than one answer. What is Dtap? We just mentioned diphtheria, Clostridium tetanus, and Dtap. So here, we're going to cover is Dtap. We have it right here. Okay, right here. And the Corynebacterium diphtheria. So the answer is N and O. Okay, question number 19. A gram-positive catalase Staphylococcus belonging to Rebecca last week group P. We already mentioned a couple of times. One bacteria, long time ago, belonging to Staphylococcus. Later on they separate. And we say Rebecca last week group D. What is that? Enterococcus faecilis. Right there. Question number 20. Can infected skin cause impetigo and deep psoriasis? Sequela fluorine, active pharyngeal infection, including rheumatic fever and glomerulonephritis. We just mentioned in the above and in the other tests. What is that? Streptococcus pyogenes. And that sentence is easy. If you see those sentences in the exam questions, it's very easy because it's described in very detail, exactly the same thing we described on the slides. Okay, that's Streptococcus pyogenes. So, in the exam, it's going to be similar, but some of them, the pathogen could be used more than once. So you have to do a conclusion, which means categorize them together. I think this set of the exam is very important, exam 2, this practice. This set of practice questions you can use to do lots of the review by yourself. Okay, what else we left? We haven't done anything regarding Clostridium, is that right? So we're going to have to do practice exam 3. This will give you lots of the examples. Talk about Clostridium. Okay, so let's jump into the case study. Again, we don't look at it on the top. We'll just talk about it. Case study number 1. 4 people attend the Cook fundraiser for local JCU, were hospitalized 24 hours with difficult swallowing, double vision, and slurred speech. Okay, neurological symptoms. Difficult to speak, difficult swallowing, and double vision. Many patrons of the event We call some level of mild stomach upset in the later evening. That's going to be food intoxication. Significant note that many of the dishes were prepared by local individuals from home canned foods. Okay, this is the key. Here are the key is neurological symptoms right here. Then the key right here is home canned goods. Laboratory data see gram-positive large subterminal endospore forming bacteria and grow anaerobically, but not aerobically from a canned yellow stomach dish. This is possible is a gram-positive endospore forming bacteria related to canned food. What is that? Clostridium botulism. Okay? So, we can do a conclusion right here. This is another group you should study. If you look at all these individuals one by one, it's hard to remember. Okay, Clostridium. What we learned of Clostridium in the class? Botulism. Botulism related to low acid foods and canned food. What's the second one? Tetanus. This is related to Dtap and the lockjaw. Okay, how about perfringens? Perfringens. This is gas gangrene. What's the last one? Difficile. This is nosocomial antibiotic related disease. This is giving you a conclusion of all the questions. You can write this on the flashcard. Then, when you see the question, you can go there to see these keywords and then go back to refreshing on your mind which bacteria it is. Okay, so this first one, Clostridium botulinum. Okay, then let's look at the second one. 17-year-old female, in her normal state of good health, developed a fever for 7 days. Did not localize symptoms, except for developing a large circular rash on her back. Okay, this is circular rash. Circular rash, okay. Various typical symptoms. And blood was cultured unsuccessfully. Antibiotic titer is 32 against the typical Sparrow-Schiss disease. This is Sparrow-Schiss. This is a Sparrow-Schiss disease. And that is in the AEM for that region of the United States. The technician decided to view the blood specimen under dark field microscope. Then which one? Yeah. Lyme disease, Borrelia burgdorferi. Okay. Question number 3. 2010 in Kentucky, 31 people have diarrhea. Okay, remember this is diarrhea. A beef cattle operation in Warren County. They developed hemorrhagic uremic syndrome. Now, I haven't mentioned this one to you in much more detail. I will mention the examination for. They plated on the McCarthy agar and the lactose fermentation possible. And developed specific cell wall carbon type antigen, which is O antigen. What is that? Which patient caused HUS, hemorrhagic uremic syndrome? I said in the class related to the undercooked beef. E. coli 0157H7. And remember, E. coli 0157H7 and the E. coli is different. There's many E. coli types of E. coli. Okay, there's lots of them are genetic E. coli, generic E. coli, which means a normal bacteria, and O157H7 is a foodborne pathogen, is a food infection. This is the one you can go back to answer this question very well. What is the difference between food infection and food intoxication? Eating toxin and eating bacteria. Is that right? The difference. Okay, then we go down. A 60-year-old male was to hospital 5 days after prostate surgery, a dysuria. The qualitative quantitative test to see reviewed E. coli in significant numbers. The physician placed the patient on a 7-day course of cephalexin. The urinary tract infection improved, but has a water-loose diarrhea. Okay, this is 7-day continuously using antibiotics. Has water-loose diarrhea, cramping, abdominal pain, dehydration, pseudomembrane colitis. And this is also, they do an AB toxin test. And they do typical, unsuccessfully treated with antibiotics. Then which one? Nosocomium, antibiotic related, Clostridium difficile. That's why I said this table, here, and here, you should be on your mind. These four, you can solve most of the questions in the exam paper. It's so simple, just those 4 pictures. But this is what I did for you. You should do this by yourself. If I'm not here, I just give these questions out. That's it, I gave you 1 week to study. These type of figure, you should come out by yourself. Okay, then that's a good conclusion. Okay, let's do this one. Blood agar can be used for growing anaerobic bacteria, cause gas gangrene. The organism is a bile bag anaerobic system. I showed you in the lab, is that right? Anaerobic cultivation. Then you see a typical hemolytic response that are characteristics of this disease. What hemolytic response and what organism is associated with this one? This is a very typical symptom for the double beta hemolytic zone. So it's which one? Okay. Double beta hemolytic zone. These depend on the division marker. Okay. 13. This is something new, relatively new. June 2012, FSIS announced fight E. coli and protect safety of American food supply. To the best of your knowledge, which steps are being taken to protect American food supply? Which one? 6 additional serological pathogen E. coli, big 6. Okay, we'll mention later on. That are being declared adulterants in non-catalog B. Okay. All these are easy. 14, 15, 16, those are easy. I'll send you the answer tonight. Okay, these are easy. How about this one? Can you do real quick? Okay, let's look at all these, okay? I don't know the answer, how to do it. Let's do it. Remember how we teach in the class? We talk about the bacteria cell attacking first. So, blocks transpeptidation reaction in cell wall synthesis. Which one? Penicillin, is that right? Okay, so we write it there. Let's do this. Inhibits DNA gyrase activity. Inhibits RNA polymerase activity. We get a little bit confused, is that right? Okay, which one? I said when we attack the DNA and the RNA, it leads the effect. So which one? So we're going to pick from C and F, is that right? Is this C? Is this C? Okay. How about this one? Inhibits RNA polymerase activity. Which one? Is this F? Okay. Disrupts membrane transport and the function. Okay, so sorry, that's what we're going to be using in a second. Yeah. Then just pick it up. Okay, we left the three. You're not going to remember everything for these, is that right? So what you going to do? And then you go back to look. Okay, let's say I forgot. Oh, not this one. Wrong one, so we pick up 4. So we go back. Can you see? Which one? Somewhere here, is that right? But I'm not going to tell you different. Chlorophynical, 15S. So, which one? Did this be? How about the blocks T RNA binding to the ribosome? So just happening. Okay, so which one? E. E. Which one we left? That's D, is that right? Nitric acid inhibits RNA polymerase activity. Is that true or not? So we're going to check. Right here. Okay. Rifampicin right here. Right here. Now this is a little bit difficult. Rifampicin is for RNA polymerase. So we want to just check. Rifampicin for RNA polymerase. Okay. This is a little bit difficult. DNA gyrase. What is the other name for DNA gyrase? Are you good at genetics? Not good at all. Is that right? Same as organic chemistry. That's another name for topoisomerase. We'll mention real quick in examination 3. Okay. I use my way to teach about chemistry and genetics. I hope you will all get it, because I find a way to teach you in an easy way. I'm serious. I'll write all the chemical structures in. Believe me, and we will do together.